I think. Oh, we're getting it recorded. Perfect. Thanks, Caitlin. Okay, great. And so again, by no means am I an expert in this topic, but my goal today is to start a conversation around mental health. Not only how you can help the patients that you're working with on scene, but also how you can help a friend, family member, coworker, and even yourself. Okay. Are you guys able to see me at all? I see in the chat says we're not seeing your camera. Oh, we got a thumbs up from somebody. Somebody sees my face. All right. All right, so we'll just keep on going then. And if you're still having issues, you can let me know. Okay, awesome. And then also, if you have access to a piece of paper nearby and you can grab one, that would be great, because there are a couple things where I'm going to have you write some stuff down and work together on that. So, or if you have your phone, you can also use that in your notepad or something like that. So, and then as far as when I ask questions, or if you have questions, feel free to type into the chat box there as well and utilize that. Okay, we'll go ahead and get started here. Okay, so what we're going to talk about today, first and foremost, we're going to do a little bit of a crash course of mental health first aid. So the focus here will be how to support someone else who may have a mental health disorder or who may be experiencing a mental health crisis. Typically, this is an 8-hour class that I teach. And obviously, we do not have 8 hours today, nor do I think you want to listen to me for 8 hours. But I do want to address a few big topics from that curriculum, including a practical tool that you can use when talking with a patient, a friend, family member, coworker. And that tool is algae, which we'll dive into later, and I'll explain what that means. After our crash course, then I want to transition into talking about how you as an EMS professional or provider are impacted by mental health disorders and how you can protect your own mental health. EMS professionals spend most of their time caring for other people, so I felt like it would be a disservice for me not to address that and how you can take care of yourselves too. Oh, let me see if I can try to mute someone there. Okay, perfect. And we'll go next. Okay, so what is mental health first aid first and foremost? So mental health first aid is the help offered to a person developing a mental health problem or experiencing a mental health crisis. The first aid is given until appropriate treatment and support are received or until crisis resolves. So just similar to EMS professionals, being that initial help in guiding somebody towards the resources. So as a mental health first aider, you're not doing the diagnosing of somebody with a mental health disorder, nor are you creating the treatment plan for them. Rather, you're that initial help and support and having that trusting relationship so that you can guide them towards the resources that can diagnose and treat. So why is it important to learn about mental health first aid? First, mental health problems are common. I think we all know that. Think how many of you know someone who has a mental health disorder. Usually I'm in a classroom setting and everyone raises their hand, but and you're kind of tiny on my screen. But just think about that. Or what about you specifically as an EMS provider? How often are there mental illnesses within the population that you're serving? I know that there's a big population here in Spokane. And then stigma is associated with mental health problems. It's another reason. And that's one of the biggest things that I love about mental health first aid in the course is the mission to reduce stigma associated with mental health disorders. When there's stigma there, it can lead to not talking about mental health issues or people don't seek help because of that stigma. That goes for other people as well as us as individuals if we are going to seek help as well. Another thing is that many people are not well informed. So this can lead to stigma again, and once again, being afraid to talk about it or seek help if needed. Professional help is not always on hand. So they're not there initially, especially when you're on a call maybe. So what can you as an EMS provider do to be that first line of help and direct someone toward the resources? How about, again, with friends, family, coworkers? How can you be that first line of help to be able to support someone and guide them towards those resources that are available to them? And then lastly, people with mental health problems often do not seek help. Again, I've kind of mentioned that here on these last couple of bullet points, but that's why, oh, actually I missed one real quick, but going back to that, this can come back to that stigma and possibly not knowing what resources are available to individuals. Go ahead and see if I can mute the person that just joined. Okay, perfect. But then also going back to that other bullet point, so people often don't know how to respond, and that's what's great about, again, the mental health first aid model of ALGE, because it gives you that structure and that guidance. And it's not going to be an in-order thing that you do, but in that moment when maybe you're a little bit nervous, uncomfortable, don't know what to say, it gives you that structure to be able to kind of go down and give you some guidance for someone that is either has a mental health disorder or maybe in crisis. More next slide. All right, so mental illness. What is mental illness? Mental disorder or mental illness is a diagnosable illness. And again, we're not doing the diagnosing as mental health first aiders, but it is a diagnosable illness that affects a person's thinking, their emotional state and behavior, so all aspects of their life, and disrupts their ability to work and carry out daily activities, engage in satisfying relationships. So when talking more specifically about major depressive disorder, anxiety, everyone experiences the blues sometimes, everybody experiences stress, but it's when it is over a longer period of time and it starts to disrupt every area of their life. Again, work, maybe not going to work or not being effective at work, maybe carrying out those daily activities, even getting out of bed in the morning can be hard, but also just accomplishing your normal day-to-day tasks. And then engaging in satisfying relationships. So the mental illness can affect their ability to relate to a spouse, family, children, coworkers, friends. Just curious, for those of you who have access to your chat box, what are some words in your community or within your EMS world that are associated with mental illness? What do you think of? What do you hear? How is it talked about? I'll leave that up in the air and see if anybody responds here. I'll give you a minute to type some answers in there. Frequent flyers. Okay, so people that calls that you go on often. Yeah. Anybody else? Is there usually a positive or negative? Usually positive or negative when talking about mental illness within, again, either your community or within the profession. Negative usually. Negative for both, you'd say. Okay, yeah, and so that's very true. And every time we teach this class, that's usually what happens when we kind of brainstorm some ideas of words that we're used to hearing. And that's the stigma right there when we have those negative talk around mental illness. And it is different for you as EMS providers because you're working with them in person, and so I I understand that that can be a little bit harder, especially when you have the frequent flyers and things like that. Someone said lonely individuals seeking someone to talk to or check in with them. Yeah. So even recognizing why are those people calling consistently? What might be going on, that feeling of loneliness and just needing some sort of, you know, attention because they have that, something else is going on there. So great. Thanks for that input. All right. And with mental illnesses too, it can definitely range on a spectrum of mild, moderate, severe, and we'll talk about kind of things that impact that as well. So here's where I'm gonna ask for some fun participation. And you can do this on your own, on your phone, on a piece of paper. You can just talk about it within your group that you're with if you want to. But this is a mental health opinions quiz, and this is just to kind of get out there maybe what some of your thoughts or initial thoughts around mental illness is. And then at the end of the crash course that we're doing, we'll check back in and see what you thought. So this is all true or false. So just kind of, I'll give you a couple minutes to just look at those if you want to jot it down or just think about it just to see. So 1, it is not a good idea to ask someone if they're feeling suicidal in case you put the idea in their head. 2, schizophrenia is one of the most common mental disorders. 3, women attempt suicide 3 times as often as men. 4, it is best not to try to reason with people having delusions. 5, people who talk about suicide don't attempt suicide. And 6, people with mental health problems tend to have a better outcome if family members are not critical of them. So just think about those. And then as we go through here, we'll answer most of them just in this presentation. And then there's one I think that we don't necessarily cover specifically, but we'll still talk about it. But we'll talk about it after the crash course. So, but another kind of little chat box thing here. What do you think the most common mental health disorders are? Most common, so you can type, we've got depression, anxiety, yep. Any others that you can think of? Bipolar, yeah, so that's another mood disorder. Yeah, any others that you can think of? Bipolar, depression, anxiety are the ones that were put in there. Thank you. Okay, substance abuse as well. Yeah, we'll talk about that. Great. Yep, and stress. Yep, okay, I'll show these statistics here. So here's a chart. Oh, that looks a lot lighter than I remember it looking, but that's okay. So we've got the type of mental health disorder and then the percentage of adults here. So anxiety disorder, we've got 18.1% of adults have an anxiety disorder, which is a fairly large amount, almost 1 in 5. And then we've got substance use disorder. Great, someone brought that up. Major depressive disorder. And then schizophrenia is way down here. It is 0.3 to 0.7%, which is very small compared to the others. And the reason why I like to bring that up, and in the class, mental health first aid class that we give, is oftentimes people think that that is one of the more common ones just because that's what we hear in media, on the news, things like that. We'll hear about schizophrenia, or you see someone walking down the street talking to themselves, and we think of schizophrenia there. Oops, I don't know how to go back. Do you know how to go back? Let's go back. Okay, there we go. Perfect. But so it is a smaller percentage, and I think that was one of the questions there on the mental health opinions quiz of whether or not it was one of the more common ones. But why does this this column not add up to 18? So we've got 18.1, and there's a bunch of percentages here, but any mental disorder, we've got 18.5%. Why do you think it doesn't all add up? Because this would add up to a whole lot more. Yep, some people have more than one, or people have multiple. Right on. Great job. So many people suffer from more than one mental disorder at any given time. So nearly half, 45% of people with any mental disorder meet the criteria for 2 or more disorders. And that severity that we talked about, from mild, moderate to severe, is strongly related to that comorbidity of having more than one, and having more than one to address. And it's really hard to treat one without the other. And we'll talk about that a little bit later when it comes to anxiety and substance use disorder, or major depressive disorder and substance use disorder. All right, so I'm asking for lots of participation. I just don't want to bore you tonight. But here's another little activity that I just want you to do, again, to just get you thinking about this topic before I just go on talking forever. So the impact of mental illness. So not only are mental health disorders common, but they also have a major impact on a person's life, causing more disability than most people realize. And when I say disability, that refers to the impact on one's work, family, social life. So again, whether you want to work with your crew that you're with or by yourself, and I'm not going to have you type this into the chat box. I just want you to kind of think through it. But I want you to order this. So there's physical illnesses on here, and then there's also the mental health disorders. And I want you to order it in order of severity of disability. Don't think too much into it. We'll talk more about it afterwards. But just start with the least severe or disabling. Let's say disabling. So the least disabling to the greatest disabling, and just take a couple minutes and put these in order, and then I will read you the order that we have. Just take a couple minutes. Okay, so hopefully you at least got a chance to look at those and think about it. And I'm going to go ahead and read the order that I have here. If I add one in there that is not on the screen, it's because I decided to leave just a couple out from the list that I have here. But here it goes. So gingivitis, low back pain, uncomplicated diabetes, and again, I'm going from least to most severe. Epilepsy, non-invasive breast cancer, moderate depression, severe asthma, severe vision loss, severe post-traumatic stress syndrome, paraplegia, severe chronic bronchitis or emphysema, severe depression, severe schizophrenia, or severe dementia. So that was the order there. And the key is not to say that one health problem is worse than the other, nor is it to say that each individual's experience is exactly the same with any physical or mental illness by any means. Instead, I just wanted all of us to realize that mental illnesses on the list are just as real and just as impactful as any other health conditions. However, it is interesting because oftentimes our response as a community to individuals with physical and mental illnesses often differ. So for instance, if you know someone who is in the hospital and broke their leg in a car accident, what do friends and family usually do to support them? They offer to make them dinners, maybe do a meal train, they bring cards, flowers, offer support, help when needed. But then think about, what if you know someone who was just admitted into the psychiatric unit at the hospital? How do friends and family usually respond? Do they respond in the same way? Maybe not really know what to do or what to say or how to help, so maybe not say anything or do anything. And this again can lead back to that stigma that is associated with mental illnesses. So I just want to encourage you to be people that work towards reducing stigma in the way that we talk about mental illness in the community, so that people in the community, our friends and family, and our friend and family circle, and even ourselves would feel comfortable to seeking help and seeking support if needed. Right. Okay, so now talking about recovery from mental illness. So mental health first aid defines or says recovery is the process in which people are able to live, work, learn, and participate fully in their communities. So for individuals, recovery is the ability to live a fulfilling and productive life despite a disability. For others, recovery implies the reduction or complete remission of symptoms. So it looks different for different people, but it is possible. And one of the kind of, again, goals of mental health first aid is to kind of encourage this hope for recovery for people. So factors that can contribute to recovery include the support of family and friends. That's really big, the support system. And when we talk about kind of risk factors for mental health disorders or even suicide risk, support from their loved ones, people around them is huge. Availability of treatment for the individual, early and appropriate treatment. So encouraging someone to seek treatment early can be a really big factor in their recovery. Opportunities for education and employment, support from others who experience similar issues. So we'll talk about a little bit later here about peer support groups or certified peer specialists, and being able to talk to somebody who also went through the same thing or goes through the same thing. And that's what's great about the EMS, I guess, world and the people that you spend the most time with. You guys have a lot of shared experience. So being able to talk about that with one another is huge. And then willingness of the individual to participate in recovery, and that goes for anything. They have to want to go seek treatment or go to treatment in order for it to be as effective as it could be. Okay, so this is the infamous algae. I wish I would have brought the little koala, but algae, I think, no, you won't see a picture of him later, but you can look him up if you want. But just like we have CAB, compression airway breath for CPR, we have an acronym to help remember different things to consider when caring for someone within the mental health first aid world. It's not necessarily, again, a fixed order that we do this, but they can all be working together at the same time. But here they are right here, and then we'll break them down. So assess for risk of suicide or harm. L is listen non-judgmentally. G is give reassurance and information. E is encourage appropriate professional help. And the second E is encouraging self-help and other support strategies. So I'm going to go ahead and break this down a little bit. Okay, so suicide risk assessment. And this might all be something that you have talked about in your training as an EMS provider before this kind of next session, but I think that it's important to still kind of go over and talk about and just kind of have a little bit of a reminder. So suicide risk assessment, gender. So males kill themselves more often than females, although women attempt suicide 3 times as often as men. So again, men kill themselves more often or complete suicide, but women attempt suicide 3 times as often. So that was another one that was on that little mental health quiz. And that's often because of the means of doing it. Males are more likely to use firearms. And then with age, so adolescents and older adults are at higher risk for suicide. Chronic physical illness, so if someone has a chronic physical illness that is really taking its toll on them, again, their mental health, physical health, so diabetes, cancer, heart disease, things like that. Mental illness, so if they do have major depressive disorder, anxiety, use of alcohol or substances or other substances is also a really big risk factor. Having less social support, so I mentioned that before, how important social support is, friends, family, coworkers. And then previous attempt and organized plan. What are the two biggest ones here? What are the two biggest risk factors on that list? Anyone wants to do the typing? Okay, I can just tell you. Oh, ooh, so someone said mental illness and chronic physical illness. So it's actually organized plan and previous attempt. Yep, we've got, someone said organized plan, perfect. Yeah, so biggest risk factors, previous attempt and organized plan. So when talking with somebody who says, yes, I am thinking about attempting suicide, the next kind of question is, okay, do you have a plan? Not to say that someone who doesn't have a plan isn't serious about it, but it becomes a lot more urgent when they say, yeah, I have the gun with me right now, and I'm going to go shoot myself. So that becomes a lot more urgent there. So those are your two biggest risk factors. Thank you for that. Okay. And then how to talk with someone who is suicidal. First of all, two myths regarding suicide. One is asking about suicide will put the idea in the person's mind. That is a myth. Two, someone who talks about suicide isn't really serious. The fact is that talking about suicide may be the way for that person to indicate just how bad he or she is feeling. So the fact that someone used that word and asked them directly might almost be a relief for them in a way to open up and talk about it and talk about how horrible they've been feeling. So asking about suicide is not going to put the idea in the person's head. If the idea is there already, it's there. But if anything, you're showing concern. If they didn't have that idea and what are you talking about? Hey, at least you're concerned and it shows that you're caring for them. And then the someone who talks about suicide isn't really serious. Again, that's a myth. I remember when Sean and I were teaching this mental health first aid course, he was teaching this section. And I still remember, it was probably a year ago, but I remember him telling the story about a first responder. I don't know in what area, but a first responder who had posted on a Facebook page about suicide awareness. And great, they were posting about suicide awareness. Maybe no one thought anything of that. And then a couple weeks later, actually completed suicide. And so that hit me home when he said that, because it just seemed like, great, he's spreading that awareness, but maybe that was a little bit of a cry for help or in that post. So not to say that everyone who posts something like that or tries to promote suicide awareness is considering it, but it just kind of opened my eyes to just being aware of the people around you and the things they say, and that if they're talking about it, again, that doesn't mean that they're not necessarily serious about it, going to kill themselves. So when talking to someone, letting them know you're concerned and willing to help. Great first step there. And discussing your observations with the person. So I've noticed this and I'm concerned about you. Do you want to talk about it? Ask the questions without dread. So if you're asking, hey, are you considering suicide, or do you have a plan? Asking those without dread. And that can be really hard, especially if you're talking with friend, family member, coworker, someone that you really love. That can be really hard. But it is important, just because, again, you want them to feel that you are not judging them, that you are open for that conversation and there to support them. And then that's the same thing with the don't express negative judgment for it as well. And then appearing confident, and that can be reassuring for the person when you're talking to them. Instead of, again, asking those questions with dread. Keeping the person safe. So this is really important, and I'm sure, again, you know about this as EMS providers, but providing that safety contact number. So I'll give the number for the suicide prevention line at the end of the presentation if you don't already have that, but that also could be maybe identifying a past counselor or something like that, or a person that you know that they would call, and providing that number. And then also helping them to identify those past supports is also important. So friends, family, who's helped you in the past? Have you ever felt this way before? Who would you feel comfortable calling? Who is there to support you? And helping them to identify that. And then involve them in the decision making. So no one wants the decision to be made for them. If you were just to say, well, I'm calling 911, that might put them on defense mode right there. No one wants to be told what to do, but rather maybe saying, you know, we have the suicide prevention line, we have your, you know, friend here, or your counselor's number, or we could go to the hospital. What would you like to do? And again, it kind of depends on the urgency of the situation. So right there on the next line, it says call law enforcement immediately if the person has a weapon or behaving aggressively. But if possible, giving that decision and having that person still have some control in the situation is really important. Do not leave that person alone if they're actively suicidal. We don't want to use any sort of guilt threats to prevent suicide. For example, you'll go to hell, or you will ruin other people's lives. That's not what they need to hear at this point. And then never agree to keep their plan a secret. Again, never promising something that you can't uphold to. Again, that trust is really important. So never promise to keep their plan a secret. Okay, self-injury. So in that A, it says assess for risk of suicide or harm. And this is the harm part as well. So maybe they're not suicidal, but they are participating in self-injury. So recognizing, it's really, really important to recognize that that self-injury is usually a symptom of serious psychological distress. So there's something else going on there that's causing them to do self-harm. Avoid any negative reactions to that self-injury. Again, we don't want them to be on defensive mode. We want to have that trusting, hey, I'm here for you, I'm concerned about you, so that they are more willing to talk about it. And then discuss that situation calmly. And focus on ways to stop the distress. Notice I didn't say focus on ways to stop the behavior or the self-harm. And the reason that is because the reason for the self-harm is that underlying distress. So if we focus on the one thing that might be, that's their coping mechanism for what they're feeling. And when we talk about coping mechanisms later, adaptive versus maladaptive, that's going to be one of those maladaptive ones, right? Something that's not good for us. But if they don't have those healthy coping mechanisms in place, and we try to take away their one unhealthy mechanism, that might lead to some more issues, maybe considering going down the suicide route as well. So we want to focus on ways to stop the distress. How can we get them the professional help or guide them towards resources to help with that underlying issue? And then never trivialize the person's feelings in situations that have led to that self-injury. So if you ask, you get in that conversation and they tell you why, and you think that's silly. Why would you be upset about that? Or why is that bothering you so much that you feel like you have to self-injure? Again, that's not going to make them feel very good, and they're probably going to stop talking to you and not come to you again. So for that person, it's really real, and we need to recognize that because everyone experiences those things differently. Okay, L, listen non-judgmentally. So this is really important for making that person feel heard, understood, not judged, being able to have that open conversation. You can ask them how they are feeling, for how long. It makes that person easier for that person to feel comfortable with you and feel comfortable talking about their problems or what's bothering them. So nonverbal skills, this is what you get in any sort of good communication class, I guess, but being attentive, so not being on your phone, not looking around at conversation or listening to a conversation nearby. You want them to know that you're actually listening to them. Having comfortable eye contact, so obviously if they don't want to have eye contact with you, you're not going to force them into having eye contact. If they're looking down at the ground, you're not going to crouch down and get underneath because you think eye contact is what makes good communication. Just have that comfortable eye contact, whatever they are comfortable with. An open body posture, so rather than being closed off, kind of, again, being closed off, crossing your legs, crossing your arms, one that's kind of intimidating, but also goes to maybe like, you're more closed off to hearing what they have to say. So if your open body posture makes them maybe feel more comfortable, less interrogated. Being seated, so if they're sitting down and you're standing over them, again, that could be intimidating, not very open, feeling comfortable there. So be seated next to them. And with the being next to someone, that can help, again, in a way say, hey, I'm with you, I'm next to you, I'm here for you, rather than being across from them, again, maybe in like an interview type setting. And then don't fidget. So if you're nervous, they're going to be able to pick up on that energy, and they're probably already nervous in general. And so this, again, so with listening non-judgmentally, you're doing this while you're assessing for risk of suicide or harm. You're doing this while in the other steps as well. But assessing for risk of suicide or harm is kind of your number one priority there. And then you can kind of move on to these next steps that we'll talk about. But this is something that you're doing all throughout, hopefully. G is for giving reassurance and information. So again, just reassuring them, treating them with respect and dignity. They are a human being, and so treating them as one. Understand that symptoms are an expression of distress or a part of the illness. So again, kind of going back to maybe the self-harm, that underlying issue is the distress. So having realistic expectations for them in what the next steps are for them, and not thinking that you're going to cure them. That's part of the realistic expectations. Not putting too much on you, too much pressure on yourself for that as well. But you're not going to be that person to cure them. Offer consistent emotional support and understanding. So that's one of the best things that you can do, especially if this is friend, family member. Obviously, this looks different if you're seeing somebody for 20 minutes on a call. But this is kind of more applicable to the people that are close to you in your life. So saying, hey, I'm here for you. If you ever need to talk, give me a call. Giving that person hope for recovery. And one of the big things about mental health first aid is that hope for recovery, whatever that means for that individual. And then always providing practical help and offering credible information. We don't want to be making things up for them. E, so that's encouraging appropriate professional help. So types of professionals, we aren't professionals, we're not diagnosing, we're not creating that treatment. So the whole kind of goal is to be supportive, have them trust you, be able to talk, and then maybe guide them towards those professional resources that have a lot more training than we do. So doctors, primary care physicians are a great way or a great place to start. And that can be one, because people are more likely to go to their doctor or primary care. That seems less intimidating than saying, hey, let's set you up an appointment with your psychiatrist or a psychiatrist. But going to the doctor, hey, I noticed, this is happening, they start talking about it. Let's go to maybe set up an appointment for your primary care and see if anything's going on. And then the second reason why it's a great place to start is oftentimes mental illness can come out in physical symptoms. So whether that be anxiety with chest pain or nausea or these other issues. In the class, mental health first aid, we usually show this video on a gentleman that had he had major depressive disorder, and he was having a lot of, again, nausea, random body aches, his chest was hurting, and he had heart disease in his family. And so he went to the his primary care doctor, and they eliminated all possible physical issues that were going on with him and kind of referred him to a counselor. And sure enough, he did have major depressive disorder. So, and those were manifesting into physical symptoms. So good place to start there. But also psychiatrists, social workers, counselors, other mental health professionals, and then this year certified peer specialists, which I talked about already a little bit earlier, but those are people that have gone through, so let's say PTSD. They have had PTSD, gone through treatment, and they've been trained now to help others who have PTSD. And that's great because you have that, again, that shared experience, at least within, maybe not the exact experience, but you both have had PTSD. So there's also types of professional help. So cognitive behavioral therapy, aka talk therapies, there's medications and other professional supports available out there as well. And then the last E is encouraging self-help and other support strategies. So this is huge. There's a lot that you can do even on your own. Oftentimes people do need to seek the professional help as well, but that in combination with the self-help, other support strategies can be a really good way for that person to work towards recovery. And these are things that are good kind of for just even prevention's sake. So maybe you don't have a mental health disorder or you're not in crisis. But again, we'll kind of talk about these things because it can be an adaptive coping mechanism for the stress that you undergo within your profession. But these are things that you can encourage someone to do as well. So exercising, getting outside, moving your body, relaxation and meditation, whatever that looks like for them, yoga, peer support groups, self-help books as well, and then the normal here, family, friends, faith, getting engaged, going out there if they've been kind of withdrawing a bit, encouraging them to get out there and spend time with family, friends, faith, they're involved in a faith organization, and any other social networks that maybe they're involved in, sports or clubs or something. So that is algae. And here we go, keep calm, when in doubt, keep calm and algae on. Unfortunately, you only got to hear that acronym a couple times, but in the 8-hour class, they're just about sick of it and you can't forget what those letters stand for. But if you want to review it sometime, you can. But it is a really good acronym to be able to kind of refer back to and just think about, especially with you know, assessing for risk of suicide or harm, and then the different things you can encourage them to do as far as professional help or in those self-help and other support strategies. So let's just revisit this mental health opinions quiz here again real quick. So it is not a good idea to ask someone if they're feeling suicidal in case you put the idea in their head. That is false. Okay, so you're not going to put it in their head. It's great to just ask that question, allows them to open up and talk about it. Schizophrenia is one of the most common mental health disorders, also false. We saw that it was a very small percentage. Women attempt suicide 3 times as often as men. We talked about that is actually true. Men just complete it more often, but women do attempt 3 times as much or often. It is best not to try to reason with people having delusions. So we didn't actually cover that one, but I thought it was an interesting kind of topic. So if anyone wants to type in the box there, what do you think? As EMS professionals, if you come on scene to somebody who is in the middle of a delusion, what happens when you try to reason with them? Don't, yeah, good call. Yeah, because that delusion is really real for them in that moment. So that can cause, if you try to bring some reason into it and justify why you're right, that could cause some agitation and put them on defense mode as well. People who talk about suicide don't attempt suicide. We've got a false there. And then people with mental health problems tend to have a better outcome if family members are not critical of them. And that comes back to that social family, friend support. So that is true. All right, so in the normal mental health first aid course, we do dive a lot deeper into the most common disorders, the signs and symptoms, and then we apply that algae model to each of those disorders. But obviously, again, we didn't have time for that today. But if that's something that you are interested in learning more about, I did link the website Mental Health First Aid at the end of the presentation if you want to look into it. And I actually think that they created a EMS or first responder module, specific module, which might be helpful as well. And then for those of you in Spokane, if you were interested, we have classes available throughout the year that you could find. All right, so here is where I want to transition and talk about the impact that this profession can have on you in and how you can seek support and protect your own mental health so that you can continue to work in this profession and give your time and energy to serving others in the community. Maintaining your optimal mental wellness is a really important part of remaining active and effective on the job, but also at home with your family, friends, and then any other areas of your life that you're active in. So Dave, the chaplain that I spoke with in preparation for this presentation, gave me this quote that someone had told him one time after a call. And a friend had said to him, and it was a traumatic call, a friend had said to him, "You are not much help when you are the one who needs saving." So again, you are not much help when you are the one who needs saving. And that is the reason that I wanted to talk about this with you today. So we're gonna watch just a couple videos here that will help with the transition into talking about mental health within the EMS profession and some tools for you. So I'm going to go ahead and play these and hope for the best. I think it's beginning. All right. Can someone give me a thumbs up as soon as, can you hear that sound? Anyone? Woohoo! Okay, we're playing.
Attention. We have a collision involving a child approximately 5 years old. Eastbound Lansdowne at Monaghan, requesting immediate response. Phil, what you'll discover at the scene is that the child has been dragged underneath the vehicle and remained conscious the whole time. She'll ask, "Am I going to die?" You'll need to assure her she won't.
That was the first one there. Then we'll listen to the second one.
Honor because I had that, I guess, the natural helping gene.
We talk a little bit about it being a bit of a helper gene that the people that do helper type work have, that where there's a sense of satisfaction that comes with the experience of helping another person.
I don't feel that anybody should be in pain either mentally or physically. If that means just holding somebody's hand while they cry or giving them medication to make them feel comfortable.
When you talk to people about the time that they called for help, it's a quintessential moment in their lives, and it's a privilege to be part of it, quite frankly.
Halifax was hit with Hurricane Juan back in 2003. I was very fortunate to be working that night, and I still consider myself pretty lucky to have been working. Unfortunately, that night we lost one of our paramedics, John Rossiter, when his ambulance was crushed by a tree. My partner and I were actually parked directly in front of his ambulance as the tree fell down, and I was the first officer and the first member who got in to the back of the ambulance during that night. And I think that was probably the initial incident that kind of set the tone for my workplace stress and for what we now know as PTSD.
I was unfortunate, you don't get to pick your calls when you're a paramedic, to have been sort of involved in 3 fairly rapid succession responses to people I knew.
We always describe it as putting a shoebox into a closet. For me, the closet was getting pretty full.
I always kind of liken it to compounding interest. You put a certain amount of money into a bank, and over time that's going to compound. And unless you withdraw from that, with regular withdrawals, it's going to compound and compound and compound.
One of my colleagues who died during Hurricane Juan, I was present for that experience, highly traumatizing experience.
The following night, we had a mother and 2 small children who were killed in a house fire.
One of my colleagues who was murdered, and I attended the scene of that particular call as well, and a good friend of mine who committed suicide as well. All three guys that were paramedics.
So in 2010, I attended the sudden death of a 6-month-old baby, which kind of broke the camel's back. I didn't really know what was going on.
People have anxiety. People don't sleep well. People are agitated, angry.
A lot of what I saw was general moods, incredibly moody, oftentimes very distant, very sad.
It's very isolating.
I started having nightmares on previous patients that I attended to that passed away in my care.
In the early stages, in the early months, and the first couple of years, a lot of flashbacks. I remembered it very distinctly being at a McDonald's in Bedford and seeing this beautiful little blonde, curly-haired Sioux girl. She might have been 3, and she was just stunning, gorgeous. And I turned around, ordered my food, and as I turned back around, I saw the same little girl that had been in the house fire that I had responded to the night after Hurricane 1, and she was there as vivid as can be. She was alive, she was breathing, she appeared in the exact same manner, however, that she did when I put her into a body bag.
I tried to be strong and be a leader and continue to help others, including my colleagues. It did end up being it won the battle with me.
For me, it was very much a perfect storm that led to me being hospitalized after a suicide attempt.
My wife always described me as an antique vase that your parents would have, your grandparents, which she's seen the cracks developing over the years, and finally that crack just got too big and the vase broke.
I get calls from friends and colleagues that are struggling, and I'm like, tomorrow you need to do one thing tomorrow, and that's you need to promise me that you're going to get out of your house for 20 minutes. I don't care if you stand on your deck and just breathe fresh air for 20 minutes, you need to do it.
God, if I can go kayaking with my little guy, I've got, an adult-sized kayak. He's got his little toddler-sized kayak. And when the two of us are out on that's therapy right there. I don't have to do anything else. I don't have to take a pill.
It was an epiphany for me that this business of being outdoors, along with all the physiological benefits of being outdoors, the mental health benefits to it were phenomenal.
You can breathe in the fresh air. You can hear the water flowing in the brooks. You can see the birds flying around. You see nature at its fullest, and it's really, really therapeutic.
It needs to be more of a priority part of the therapeutic index. We need to start saying to people, along with getting help and seeing doctors and surrounding yourself with good people and taking medicine, all those things, we need to start to say, one of the things you need to do is get outside. There's no pill bottle or therapy session or any of those things that I find do as much for me as that does, and I can do it when I want to do it.
Okay, I need to be able to breathe. Well, for me, I associate breathe with breathing fresh air. Breathing fresh air means breathing clean air. Breathing clean air means, to me, there's nothing better than being by the ocean or being on the ocean or being in the woods. That's what kind of knocks everything down for me.
Alrighty. So again, I just thought that would be a helpful way to transition into and kind of emphasize why it's important to talk about this. You see a lot, you experience a lot as an EMS professional that can build up over time, and that can really start to take its toll. And you never know what event could do that to you. Maybe one's a tipping point, but that is why I think it is important to talk about mental health within the EMS profession. Let's talk about the impact it does have. Some numbers here. So I thought this was just shocking, and Sean actually showed this to me, and I thought it's a really good visual, but I looked into it a little bit more, and so this group called the Reviving Responders did a research project that looked at responders who had experienced what they called critical stress. So they define that as the stress we undergo either as a result of a single critical illness or incident that had a significant impact upon you, or the accumulation of stress over a period of time. This stress has a strong emotional impact on providers regardless of their years of service. It also looked at the number of first responders who had contemplated suicide or attempted suicide. And the blue here is the EMS provider survey respondents, and the orange is the CDC national average. So you can see the drastic difference between those. They ended up having 4,022 EMS providers participate in the survey that they created. The results show that 86% of the respondents experienced critical stress. But the most shocking discovery was that 37% of the respondents had contemplated suicide, and 6.6% had actually tried to take their own life. Those statistics are roughly 10 times greater than the national average for adults in America, according to the study done by the CDC. So again, the point is, from just looking at this, that EMS provider stress is prevalent and the impact is great in our country and needs to be something that we talk about. So let's go ahead and talk a little bit about the factors that can contribute to your mental health as an EMS provider. So maybe some factors here that negatively impact overall mental health or can negatively impact mental health, and that's your exposure to trauma, the life-threatening situations that you may be in, the really long hours that you endure, and quite possibly little or no sleep on the shifts that you are working. And even if you get some days off in between, it almost seems like it would be hard to recover from that. So those are some things that can negatively impact. And also, I forgot to mention here, a lot of what I'm about to talk about here is from the American Addiction Center website. Again, it'll be linked at the end. But they had a lot of good information specifically for first responders. And then factors that contributed positively or can contribute positively to mental health include those positive relationships with coworkers. You spend a lot of time together and have some bonding time, and again, kind of experience things together. So you can have those positive relationships. Meaningful and important work. I hope that you find what you do meaningful and important. The community thinks so. We appreciate that. And then productive and or positive atmosphere in the workplace. And hopefully you do have a positive atmosphere within your workplace. I sure hope you do, but if it is positive, then that positively impacts your mental health. And then your livable wages and benefits that you get as a first responder. Again, hopefully you feel that way too. So those are things that can impact your mental health. So talking a little bit about common mental health issues among first responders. So again, you see a lot as a first responder. You see the effects of fire, emotional and physical damage caused by accidents or abuse, the threat of personal attack, high stress environments, inability to save everyone that you attempt to help. That in combination with difficulties at home or other personal issues that you may have can all contribute to the high rates of mental health disorders commonly diagnosed among first responders. So I'm going to briefly go over these. Again, in mental health first aid, they go over this a lot more detail, and you can talk to somebody else about it as well, or look it up, but I'm sure you've heard of many of these. So PTSD, that can be the re-experiencing of the event that you went through, unexpected flashbacks of those traumatic events that maybe include the same rapid breathing and sweating you originally experienced in the event. It could be nightmares, or other intrusive symptoms characterized in PTSD. Maybe that feeling on edge or an intense anger response, easy irritability, or feelings easily startled. Or there's avoidance PTSD as well, and that's that feeling of guilt and depression, or having no feelings of attachment at all, maybe difficulty remembering the traumatic event, a lack of interest in your former hobbies, the things that you used to enjoy doing, and just kind of avoiding those. And then maybe avoiding places that trigger memories of that trauma as well. Then anxiety and depression, again, two of the most common ones just nationally in general. So a lot of us know the signs and symptoms of anxiety and depression. But anxiety, the symptoms vary depending on the person, but maybe include those intense fears of specific places or things. Maybe it's obsessive thoughts that are really intrusive, can disrupt your sleep and your eating patterns, and it can increase your risk for substance use as well. Depression, and first responders suffer from this ongoing deep feelings of hopelessness, loss, maybe suicidal thoughts and behaviors, guilt, insomnia, not being able to sleep, and other issues related to the disorder. Again, this can be diagnosed on a scale of mild to severe, or it can be a symptom of another mental health disorder such as PTSD. And then this is another disorder that can be worsened or driven by substance use and addiction. And then substance use or abuse, this is an addiction to drugs or alcohol, and it's defined by compulsive use of the drug despite the negative consequences that result. So you know that it's not good for you or it's harming your body, yet you continue to use it. It is a chronic disease that causes physical and discernible changes in your brain, and thus in the person's mental and physical health and personality. So people who are diagnosed with addiction often require professional help and addiction treatment. And then when we talk about the adaptive coping strategies that, in just a couple slides here, this substance abuse would be considered one of those maladaptive ones that we want to be looking out for. And then co-occurring disorders. So we talked about that earlier when we looked at that chart of why doesn't it add up in America for our percentages. It's often because nearly half of people have co-occurring disorders. And the two issues often significantly impact one another, making it difficult to treat one without treating the other. So for instance, again, if substance abuse is a problem, have anxiety, the substance use is the way to cope with the anxiety, and it becomes this addiction, it's going to be really hard to stop the substance use if we don't address the underlying anxiety there. So they're often addressed and treated together. And that's why it is important to talk about healthy coping mechanisms and even being aware of yourself and the way that you tend to cope with the stress that you endure, but also looking out for your friends, your coworkers. How do they typically cope as well, and being able to look out for especially that substance abuse. All right, so quick little rundown on stress. You all probably know this already, but stress is any disturbance in a person's normal balanced state and its unique response to a stressor. So, and individual to the person. So two stressors may cause different responses in two different people. We'll talk about why here in a minute, but it's different for different people. But it's also, it can be harmful or motivating. So it's not inherently bad or negative. However, when we experience high levels of stress over a long period of time, when that is when it can start to really impact their life and cause harm to physical and mental health. But in general, stress, we all experience stress in our lives. If we didn't have any sort of stress, we'd probably just lay on our couches and not do anything and not have motivation to do anything. So it's good that we have some stress in our lives, but it's when it's extended over a long period of time, and you're in a profession where it is a higher stress job, and you're often faced with stressful scenarios. So, and putting your body through that. Okay. So oh, this is a boring slide. I apologize. You'll just have to listen to me. But factors that can impact stress management. So this is, again, what can affect our way that we respond to stress. So one is precipitating events. This is the baggage that you bring with you, the years that you've been in service, the events that you've seen over time. I think in one of the longer video, it talked about trying to shove shoes into a shoebox, or one guy talked about compounding interest. But when you experience these stressful events over a longer period of time, those can build up and affect the way that you respond in a stressful situation or when you're experiencing stress. The perception of the event also affects your ability to respond. So again, we all perceive events, stressors differently. And it's going to be different for each individual. But I kind of think of the first thing that I thought of when I was thinking about this with the perception is that obviously a pediatric call, a traumatic pediatric call, is going to be hard for everyone, and often you'll have some sort of debrief about that there. But maybe for a parent, that went on a pediatric call with a child that same age as their child, it might hit them a little bit differently or affect them a little bit differently. Their perception of the event might be a bit different than a younger EMS provider who doesn't have any children. Not to say that they won't experience stress and have to debrief that, but it's just going to be different. And then the coping skills. So how do you manage stress? How do you manage it on the scene? How do you manage it after? You debrief. What about once you go home and you're off shift and thinking about it or feeling stressed? So think about that for yourself, but then also think about the people you work with and that you're close with and maybe friends with outside of work. But how do they handle that stress that they're enduring during work? Look out for each other, check in with one another, see how they're handling the stress, how they're coping with it. And we want to try our best to encourage those adaptive rather than maladaptive coping skills. So speaking of, we've got our adaptive. So those are our health choices healthy choices there, that should say healthy, that directly reduce the negative effects of stress. So these are good. This is what we want. So that's seeking support, whether that be from your crew, from resources that you have within your department, or within your family, friends. Meditation, problem solving, writing things down, list making. I know for me, just writing things down can be really helpful, or my thoughts down. And then physical activity, getting outside, being active, eating well, all good things, healthy choices that can directly impact or affect that stress. And then maladaptive. So these are unhealthy choices. It's a temporary fix that can lead to other harmful effects. So we're talking the substance abuse here, overeating, social withdrawal. So that might help you feel better for a shorter period of time, but it's causing other harmful effects, but also it's just temporary. So you're going to have to face those issues again. And so finding those adaptive ways to cope will be really helpful. Okay, so now here's where I personally have less knowledge and where Caitlin might be able to help me, and might just be a conversation that you have afterwards as far as your resources within your department or where you're working. But these are some things that you can do to protect your mental health. And this is what Dave, the chaplain, talked to me about. So one, your crew. Who you're working with. Those are the people that you can and should talk to the most because you have that shared experience, and over time you've established that trust to be able to talk with one another. So that's a big resource in itself. And then officer or the crisis intervention stress management or whoever also is your leader on that call. Having those debrief sessions after a traumatic call and being willing to participate in that. Obviously, not everyone is forced to talk, and if you don't feel comfortable with that, maybe that looks like reaching out to your person of leadership afterwards and just saying, hey, I didn't speak up earlier or whatever, but I am kind of having a hard time with that call, or I need help processing it, or just talking about it. And they have some tools in their toolbox to be able to kind of guide you in the right direction and be able to help you find help or someone to talk to about it. The chaplain, another great resource. Maybe Dave, the chaplain, just told me that because he is one. But he said he does really love to talk to people. But they are really, in all reality and seriousness, they are a great resource, someone that you can talk to on the phone or have an in-person meeting with. But they do love, that is their job, is to be able to talk and help you first responders or you EMS professionals. And then the employee assistant program. So that's something that I think, and what he kind of said was, often goes without people taking advantage of it. It's there. You have free counseling available. Again, I don't know exactly what that looks like for you in your area, but it is worth looking into. And this is where a little bit of my personal opinion comes in. But I am a big advocate for counseling, even just for the sake of prevention. I don't think that you need to be in crisis or even that you have to have a diagnosable disorder to get something out of counseling, whether that be just being able to talk to some non-biased third party who really has no idea or won't talk about it to anybody else, or they can help with coming up with those healthy coping mechanisms. I think it's a great thing to take advantage of. So look into that and look into your employee assistant program, see if that free counseling is available to you. And I also, in addition to this, as far as the resources, have a slide next that just has a list of numbers that you can call as well, specific to EMS professionals. So obviously you have the suicide prevention line that you can call, but then there's also 3 that I have listed that you can call, and there's another EMS provider, first responder on the other line who is trained to help you and be able to talk and guide you towards resources as well. So that's great too. I'm just going to invite Caitlin real quick to add any other things that she wants to say specific to debrief or whatever that she knows about the EMS profession.
Sorry guys, I'm just rolling my chair over here. So the biggest thing is a little bit about me. I come from a primarily volunteer department, but I have been a volunteer firefighter EMT for 4 years. And my biggest thing takeaway from this is like being a first responder, firefighter, or transport agency, or, you know, I'd say outside of the hospitals, like the front line, first on scene, you most likely are going to respond to most of your clients or patients. It's the worst day of their life. And whether that's like a family member is dying or their house is burning down or whatever the situation may be, to them, it could be literally the worst day of their life. And we have to compartmentalize and treat our patients or treat the situation and do, you know, our job. And I always say that people don't see the call until after the call is over. So as a first responder, when you go on these bad car accidents or these cardiac arrests or structure fires, stuff like that, you don't necessarily, like, you do your job and you see it, but you don't see everything until you're done and you start to think about it and you break down the call. And that's when usually it starts to set in, is it's not usually on the call, but it's after. And I always say that you just want to communicate with your crews, especially those who are more senior firefighters or officers or just going up the chain of command. Pay attention to who you have on your truck, especially if you come from like volunteer departments. You can have brand new people on your truck all the time. And me, as being more senior than some people, I work with a lot of new recruits and I try to pay attention who's with me. So if we go on a cardiac arrest, I might have been on plenty of cardiac arrests and they don't bother me, but that doesn't mean that that new person on the truck has never seen a dead body before. And you just want to pay attention to your surroundings and realize that that might be the first time for somebody. And so I always recommend on cardiac arrest or any major medical call or traffic accident or something that is definitely intense call, just talking about it, you know, going over the call, what are the pros, what are the cons, how are people feeling? And I always just recommend like telling people it doesn't make you any less of a man or a woman if it bothers you or it makes you cry or anything of the sorts. You have your crew. We are a team that you're supposed to communicate, and always identify to those people that you are someone that they can come talk to, especially initially because you went through the same thing with them as their first resource, but then going further in what you can do to help guide them in a direction if it starts to bother them even more. I always say that most first responders have that one call. There's that one call that just really gets to you. And you don't know what it's going to be. You don't know if it's going to be a child. You don't know if it's going to be an elderly patient. You don't know if it's going to be a car accident, a structure fire, or turned into a fatality fire. You don't know. And so you want to know like the resources to help your crew, but also for yourself. Like for me, my first call that ever, I was 3 years in and didn't really feel like things like bothered me too much. And then I had my first fatality fire. And that call really got to me. And I was there for 7 hours and it was a really long day. And we actually had to pull in for my entire crew. My fire district pulled in a counselor, like an outside source, and we called the dispatchers because in my county, we communicate with our dispatchers. We don't have all the fancy technology. And we called the police officers that responded, and we had a huge AAR, so after action review about the call, and just the counselor was able to give more in depth of resources that were available. So just the biggest thing is start with your crew, but just especially as you're higher up in the chain of command, just communicate with your crew and let them know that you're there, and just pay attention to your surroundings and the people you work with.
Thank you, Caitlin. That was awesome. See, that was a lot more insight than I could give into that. So I appreciate her doing that. And then identifying your support system. So we've talked about that a lot already. Friends, family, coworkers, who's there to support you. And thinking about too, a name, think about right now, the name of an individual. Obviously you don't have to say it out loud, but think of the name of an individual that if you were in crisis, or if you needed to talk to somebody, who would you call? Dave likes to Dave told me that he likes to have responders write that name down and stick it in their wallet. I'm not going to tell you to do that right now. I can't even see if you guys would all do it. But it is important to start to think about who that person would be, because it might seem silly now while you're not, maybe you feel like you've been in pretty good mental health or had a pretty good mental health up until this point. But you never know what that call is going to be. You never know when that's going to happen and when you might kind of hit that point where you feel like you need some help. And so thinking about who that person is, so that in the moment when that does happen and you feel like you just need to call somebody, you can pick up that phone and call that person. So think in your head kind of who that would be. And then maintaining your health and stress management. So that's all those coping mechanisms that we already talked about, the healthy ones, the adaptive ones. So exercising, getting outside, doing your hobbies, writing your thoughts down, seeking support and counseling, seeking support from your crew, utilizing those resources that your job provides. Those are all great ways that you can help yourself and protect your own mental health. So lastly here, here are the phone lines that you can call if you need to talk to someone or get connected with resources. So those first three are all EMS first responder specific. So the person on that other line is a first responder. And then the Code Green campaign, that's where I actually was exploring some and got these numbers, although you could just find them online anywhere. But that's where I got these resources. And it is a first responder oriented mental health advocacy and education organization. So if you want more information about that, or and there were a lot more resources on their website. So if you want more information about that, go ahead and you can check that out as well. Here are my resources. Again, videos, the Code Green campaign, American Addiction Centers, mental health first aid. And now I hear you guys have a post test you have to take. I don't know. I'll just go ahead and scroll through these and we'll talk about them. You can type in the chat box here. There's just 3 questions. So question number 1, what does ALGE stand for? If you remember, you can type one of the letters in. Or you can, yes, assess for risk of suicide or harm. Great, there's one. What's the L? Listen non-judgmentally. Woo, okay, G. It's kind of a weird one. Not as obvious. Give. Yep, that's good. So it's, anyone else have an idea? Okay, yep. Give reassurance and information is that G, great. And then E, the first E, you can, I guess, do either one of them. Encourage appropriate professional help, perfect. And last one, encourage self-help and other support strategies, awesome. Okay, question 2, what are 2 examples of adaptive coping mechanisms? Seeking support, yep. Physical activity, healthy choices, spending time with family, more physical activity, perfect. Okay, exercise, great. Thanks, guys. Camping, yes. Camping, getting outside, meditation. Nutrition, you all are so smart. Awesome, thank you. Great, okay, lastly, list 2 resources you have for if you are experiencing a mental illness or a crisis. Your crew, perfect. The golden answer. Yep, EAP, SISM, yep, counselor, great. Primary care physician, awesome. Great job, thank you for responding to those. Looks like your next EMS Live at Night is on September 8th, 2020. Keep calm, there's always next season, apparently. Apparently tonight was the season finale. I feel like I should have left you on some sort of cliffhanger. Maybe I did, I don't know, but I don't know if it was a good season finale. Rosters and certificates, do you have anything to say about this?
For those of you that have joined EMS Live at Night, you know to submit your rosters as well as your post tests and send it to our health training inbox. I receive them and I sort them and just keep them on file for if they're ever needed, or you can fax them. So health training at inhs.org. Just make sure to try and get those in within the next 24 to 48 hours. Just so that's when I'm actively really looking for them. But obviously if you get them in late, that's okay. But just write down who all attended and make sure to get yourself a certificate and fill it out.
All right, thank you so much, everybody. Thanks for listening in and participating. I appreciate it. Thank you, Stacy.
I comment.
Yeah, go ahead. Did someone have a comment?
Maybe they said I'm coming.
No, never mind.
Well, thank you, everybody. Okay, should I exit? If anyone has questions. Okay.
Hit and share section. get